Okay, well, follow up on my wound. So this is after 3 days. This is the dressing. I didn't have to change it. Um, as you can see, it looks like the pad did, like I said, like I didn't open that yet. Um, uh, there's no. I kept smelling, see if there would be foul smell and stuff. And what I kept doing is pressing over here to keep an eye on this. This is still a little bit sensitive, so but it's much better. The bottom part here, like I was saying before, that it was a little bit more numb. It's not, so it looks like the compression really helped on that. And the dressing obviously stayed loose because it didn't put any pressure. But as you can see, when I was talking about those dressings, this is after like 3 days of use. I even took my shower with this. Obviously, I didn't take this. I put it in a plastic bag. But as you can see, that just even like regular use, so driving and cooking or whatever, it stayed well in place. I didn't have to re-wrap it or anything like this. I put just a little piece of tape because I found like when you put the ends, they have tendency to let go. So if you put just a little piece of tape or something, it does good job for to keep it kind of stuck on it. No, it stays on and stuff. So we'll. I bought yesterday. I bought a piece of Aquacel AG. So that again, silver, meaning that it's there's silver in there. Hopefully, it looks like it. Again, I didn't see it, but my plan is that if the pad is not saturated, which seems like it's not, I'll apply this and I'll be able to kind of probably lower decrease the size of that thing, because all I'll have to do is put a little piece of this on it, and this. But I wanted to talk about the price point of those things. So I bought one, and again, because I have the supplies here, but there's supplies for when situations are not supposed to happen. So that's why I bought it. So this little piece, and people will jump a little bit of the price. This was $34, but again, you have to think about something, because a lot of people, this is why they don't use those districts. So like, yeah, this little piece here, I bought it myself from a store and everything, was $35. So the thing that this, a lot of people don't think about. So this has been on for 3 days. I didn't change it, I didn't play with it, I didn't do anything. I applied it, I left it on. First is a big advantage if you're on the move or in a bog out situation, or if I would be in the outdoors. So that means I probably could have hike and do whatever with this thing for 3 days, because I didn't have to change it. If I would have used gauze, this would have been a change every, at least twice a day, at least, depending of what the stuff. So now, not only that you're changing a lot, you're pulling out and stuff, and there's pain associated with that, because the liquid that would have come out of that would have made it kind of all glued in and attached to it. There's also, now you got a lot of garbage, because now you have all those gauze that you have to carry with you as you go along, and everything like that. And plus the time frame, so you have to do your dressing every 2 weeks, 2 days, twice a day, sorry. And also the cream, because the silver that you could put on gauze, there's just gauze by himself, would have increased the risk of infection, because also it would have kept a little bit more humidity around the wound. The thing with the gauze is that you would have to apply a cream that we usually use, which is called Flamazine, which was the one, usually when you go with gauze, you have to go with the Flamazine. Well, Flamazine has to stay in the fridge to be stable and stuff. This, I just carry in my backpack like this. So yeah, so the change of dressings, all the healing and stuff, It doesn't have the gauze himself, doesn't have antibacterial, so you have to buy the cream. Well, now the price of the cream, the diaflamazine, is very expensive, so you have to put that in. If you have risk of infection, then that's the second part of the beauty with those things. If you have an infection on your thumb, and actually on this arm one time, I scratched myself or something and kept scratching. It got infected. I never knew what kind of infection it was, but I could see it was crusty and gold, and usually that's a strep kind of infection. But it wasn't sure. I didn't do a culture. I didn't do so. I don't know what kind of cream, because obviously different infection you're supposed to use different things, because you need to know what's in there to stop. I apply a smaller one than that. I apply a small one over there, put that on, leave it for 7 days, the infection was gone. This is the other advantage of stuff like this. You don't need to, for outside use, obviously, you don't need to carry antibiotics, and you don't need to know what's your infection. This will kill pretty much everything, because of the way it kills. There's like 6 different mechanics that it kills whatever you have over there. So there's studies that shows about that stuff. So this is the advantage of that, is that you don't need to know, and again, in self-reliance, and you're not in the hospital and stuff, you don't know what's on the skin, you don't know what it is, you don't know exactly what it could be, and you could use the wrong antibiotics, and sometimes even antibiotics per the amount won't work very good, so then you would need different creams and stuff. So $35, I put that in my backpack, and that's it. When I have an infection, so I recognize stuff, and I talk about that in the past, the nerves and the stones. I recognize there's an infection, boom, I put that on. Burns, I go straight ahead with this because they're more at risk for infection, and also silver helps with the healing process of burns. That's what flamazine is kind of a silver compound, or there's silver in it. So that's why for burns we go straight to silver. So now I can treat burns and also infection outside my skin. So that is the advantage of that $35. So yes, one dressing is very expensive, but look also at the size of it. You know how much gauze it would have taken for the last 3 days to do that dressing? Would have been ridiculous. Well, you saw the size of that little pad. So now 3 days later, that's the same dressing that I have. That's it. So that's the beauty of it, is that you can carry, you can even have 4 or 5 of those pads. So that means now if you have like 2 or 3 of those wounds there, you can carry that. This also, see how the size of this thing? So depending on what I'm going to see, I'll put one piece and that's it. So yes, it is expensive, but that is the advantage of this versus gauze and versus anything else. And I'll prove it myself on me, and to prove that, you know, I truly believe in those things. And it's not because I believe in them because they work for me. It's just literature support the use of those things. So that's why I don't understand. Yes, they're expensive. That's why actually they don't make it in first aid kits. But at the long run, it's a better investment to buy something like this than having to buy the antibiotics, the creams, and all that stuff that maybe won't work, and maybe even will worsening your wounds and stuff. This is a little bit like a Swiffer. It's a Swiffer on steroids, but it's like a Swiffer. All the infection that I have, if I don't have too much, and it seems like that's what it is because it didn't go through it, will take all the bacteria and stuff. Just like when you toss your Swiffer on the ground, it will aspirate dirty, and all the bacteria will kind of stick into the kind of fibrous process that it goes into that package, and it will stick in there. And all it'll keep is the good stuff over there and create a kind of a soup. It's a little bit like I put the cream. So the cream is the gel that I put is a little bit the same thing on those things, but it's a different compound because it needs liquid for stuff and everything. So this is why they're expensive, because you're paying for the technology of it, but the advantage of it, it's much better. So anyway, we'll open that up and see what it looks like. I'll show you, and then we'll take a decision from there about what new dressings to put. Stick around. Okay, so I took off the thing. So this is the pad. The wound actually looks not too bad, beside one spot. And actually that's exactly the spot you're seeing right now. That white spot mean there's a sorry, too much maceration. So that means that, remember when I spoke about dressing, not too wet, not too dry. So that's what it tells me, is that there was too much humidity on this. And it's funny because the pad is dry pretty much here, but you feel like there's wet here. So I think it's like the way it's come down. So I'll show. There we go. So that's the. Let's put it sideways. Sorry about that. So yeah, that's the white part here, and then you got the other part kind of over here there, which is kind of dry and crusty, so it's kind of interesting. But some liquids kind of came down, and doesn't seem to have lost too much. So this part is still a little bit sensitive, but the redness that was around here is has disappeared. That's a good sign, and it's still sensitive a little bit on the side here. So I'll clean this up, and I'll get back.